And so this webinar is part of a virtual series that the Gun Violence Intervention Team is hosting in honor of National Gun Violence Awareness Day, also known as Wear Orange. This is an annual event that happens in early June each year with the support of Everytown for Gun Safety and Moms Demand Action. And it involves cities and counties across the country coming together to recognize this day by hosting community events and official proclamations claiming their commitment towards addressing gun violence. And so we want to thank all of you for joining us in this national movement as we raise awareness about gun violence and as we honor the victims and their loved ones of gun violence. We have a very informative session planned for this evening, and I have the honor of being joined by a phenomenal array of speakers who will be sharing about the topics that you see on this screen. And so I appreciate each of their leadership and their expertise in sharing as we collectively raise awareness about gun violence, both locally and in conjunction with all of the other jurisdictions recognizing today. And so we'll hear from each of the speakers on the screen, and then, as I said, we'll have time for some Q&A at the end. So if you have questions at any point, you can put those in the Q&A queue, and we'll make sure to get to those at the end. And so with that, I would like to first introduce Dr. Kaliana Rahman, who is the health officer for Anne Arundel County, who will be sharing some opening remarks, sharing the importance of this work and why, and the importance of using a public health approach to addressing gun violence.
Thank you, Bella. And thank you, all of you, for joining us today for our National Gun Violence Awareness series of events. As Bella noted, I'm Dr. Kaliana Rahman, the health officer for Anne Arundel County. And this session that's kicking us off is Understanding Gun Violence in Our Community. And it's the first of a three-part series in addressing one of the most challenging public health problems we have today, gun violence. Gun violence causes death, injury, heartbreak in our county, our state, and across the country. When we think of gun violence, mass shootings grab the headlines. But there's a daily drumbeat of homicides, suicides, injuries in our county. It traumatizes families, communities, and those who are injured and survive. For too long, our energies in addressing gun violence have focused on the word gun in gun violence. Different sides have different opinions about guns and whether there should be more or less. Whatever your opinion on that, it's a fight that hasn't led to progress on decreasing gun violence. It's led to paralysis. When we talk about gun violence and focus on the word violence, we have broad consensus that there should be less violence. That is our shared understanding, to save lives and protect health. Now, all of you probably remember the Capitol Gazette mass shooting in the summer of 2018. It was a shocking event. It led to much soul searching. In response, our county executive, Stuart Pittman, in the first months of his administration, brought together a gun violence prevention task force. Its charge was to understand the scope of the gun violence problem, and identify potential solutions. One of the key recommendations was to address gun violence as a public health issue. So what is a public health approach to gun violence? It involves understanding the data, listening to the stories of those affected, identifying evidence-based solutions, and implementing them in partnership with the community. Dr. Georges Benjamin, the executive director of the American Public Health Association and a former secretary of health for the state of Maryland, will be giving the keynote address on addressing gun violence as a public health issue. This is what we do at the health department. We do public health. We've taken on this challenge, gun violence, by forming and leading a gun violence intervention team, and it's modeled on our successful opioid intervention team. It brings together a wide range of expertise from across Anne Arundel County and Annapolis city agencies, academics from Anne Arundel Community College, and experts from the Johns Hopkins School of Public Health. We're unique in Maryland and in the country in our county-wide structured public health approach to gun violence. The gun violence intervention team's work is organized in three groups: data, policy and education, and environment. And each of these groups is focused on identifying interventions that'll advance our work of decreasing gun violence. There are three main goals for this team in the coming months. First is to create and publish a monthly data report of gun violence for Anne Arundel County. Second is to develop and implement the public awareness campaign about safe gun storage to prevent gun violence. Dr. Paul Nestat from the Johns Hopkins School of Public Health will speak about one piece of this, lethal means reduction in suicide, later this evening. And third is to implement a coordinated crisis response for reporting and following up on gun violence incidents in the county. Our county is a leading member of the National Gun Safety Consortium, a coalition of law enforcement and government leaders who are applying their expertise and purchasing power to promote gun safety. County executive will share more about this shortly. And Anne Arundel leads the state in the use of extreme risk protection orders, which allow for the temporary removal of firearms and ammunition from people who pose an imminent risk to themselves or others. Dr. Shannon Frateroli from the Hopkins School of Public Health will talk more about this later this evening. But I think key to this series are the second and third events, Turning the Curve on Gun Violence tonight at 6, and Violence Intervention Partner Workshop tomorrow at 1. These two events are our opportunity to engage with community members to understand the lived experiences of those affected by gun violence and partner to implement solutions to address this issue. Mayor Buckley of Annapolis will speak on the necessity of community engagement on this issue and what it looks like in the city of Annapolis. I'm heartened to see so many of you here to bring our collective energy to address gun violence as a public health issue. We're coming together to better understand what gun violence looks like in our county, to identify ways to reduce gun violence, and engage with the community to chart our way forward. The series of events over these 2 days build on work that is already taking place to move us farther and faster to save lives. This is what a movement looks like. And with that, I'd like to introduce the Anne Arundel County Executive Stuart Pittman to share his thoughts on the significance of gun violence in the county.
Thank you, Dr. Kaliana Rahman. I have to say that bringing Dr. K on was a real breakthrough in this work. He's right that it was early in our administration that I announced Executive Order number 9 to create the Gun Violence Prevention Task Force, and we engaged every sector of our local government, our partners in Annapolis, a lot of community members and residents who had a real desire to do something about this public health issue of loss of life and injury to gun violence. And it was a little bit controversial. We were told that local government really doesn't have much to say or do about gun violence. And we pushed back on that. And you know, I personally, I don't hate guns. I remember when my dad gave me an air gun for Christmas, and it was probably the most exciting Christmas present he had ever given me. And I grew up on a farm, and I have used guns and shot clay pigeons with my grandfather. And you know, I think a lot of us who were on that commission were gun owners or grew up in households with guns. And that wasn't the issue that this commission was getting at. The issue was how to make sure that people who are prone to violence or who have threatened violence or are not should not have guns don't have guns. So we have to separate the guns from the people who intend to do harm. And it was just a few weeks ago that we had a shooting in Maryland City near Laurel, the western part of our county. And I got a call from the police chief late in the evening and went out there, and a person who had a restraining order against him, but did not have an extreme risk protection order that could have potentially taken away his guns, walked into the home of his former girlfriend and shot and killed 2 parents of 2 kids, and shot a 10-year-old boy as well, who's still in the hospital and survived, has a younger daughter who survived. And anybody who was at the memorial service for that family would tell you that if that one shooting had not happened, it would have made a huge impact on our community. If that one red flag ERPO had been filed for, and that one person had not had a gun in his moment of anger, it would have made a huge difference to our community. And so while I know that Not everybody, not all gun violence will be stopped anytime soon, probably ever. It's worth doing this work. It's worth saving somebody and hopefully large numbers of people in this work. So I was thrilled when out of the task force came 55 recommendations. I mentioned Dr. Kaliana Rahman because he came on during that task force, and I would say he really helped to provide direction to it with the public health approach, and then taking it to the next level and bringing on board Bella Young into the health department to staff the gun violence intervention team, where we bring together all of our departments to do anything and everything that we can do and work with our local partners. It was modeled a little bit after the opioid intervention team, which Bella also staffs. It's the other half of her job. And that was something that was mandated by the state of Maryland. And I would love to see the state of Maryland mandate gun violence intervention teams in every county. I would love to see more counties across the country approach this work from a local level and a public health perspective. So what I hope that you'll learn today is that there are things that we can do at the local level. And Dr. Kaliana Rahman talked about some of them. I know I'm thrilled that we have Dr. Georges Benjamin from the American Public Health Association here witnessing what we're doing in our county, because I think it really is pretty innovative. And lending his stature to this and to that organization's support for the work that we're doing. So thrilled that we're doing this today. Tomorrow, I hope people will participate as much as they can. I know that this will be the video will be live on forever, and people can refer back to it. And so thank you, everybody who's participating. Do I go? Who do I go? Who do I pass it over to?
I got you. Thank you, County Executive. And with that, we're going to turn it over to Mayor Gavin Buckley of the City of Annapolis to share his thoughts on priorities around gun violence.
So good afternoon, everybody. I'm Annapolis Mayor Gavin Buckley. Here in the City of Annapolis, our residents have suffered in the aftermath of both a mass shooting incident in 2018, as well as everyday gun violence in our communities. I'd like to start out firstly by thanking County Executive Pittman for his work on this extremely important but very difficult issue. And thank you to Health Officer Dr. Nylash, Kaliana Rahman for organizing the team, and Program Manager Isabel Young, and all the coalition partners for partaking in what has to be one of the most difficult conversations America can have. Annapolis and Anne Arundel County residents should feel lucky that elected leadership is treating gun violence as the public health threat that it truly is. We've just come out of a tough year with COVID-19, the social cost of isolation, the economic uncertainty around the pandemic led us to a particularly bad year for gun violence in our city. According to police, Annapolis had 155 reports of shots fired, with 15 verified as evidence of shots fired, resulting in 20 injuries and 6 fatalities. Gun violence is a public health issue, and one we hear about regularly from our residents. Too many guns on the street, too many gunshots in the community, too much trauma for our children and for survivors. I think about it every day. It is why we're working actively to find solutions in our policing model. We seek to interrupt the cycles of violence. To be successful, we have to look beyond policing. We have to give residents resources to find better ways to resolve problems, to lift up economic opportunity, to help with substance use, public health, and mental health. In all of these areas, one central theme emerges. Much of our gun violence has its underpinning as a health issue. As a city government leader, it is my job to find ways to divert crisis, to find solutions, and to deliver resources to communities to help solve problems, particularly in marginalized communities. I believe that if we can change the environment and help people move beyond the drivers of isolation and poverty, we can change outcomes substantially. That is why we are developing programs, including job training, re-entry programs, social workers working one-on-one to deliver health resources and mental health services, no harm violence interruptions programs, and drug diversion efforts. We have staff working in communities, literally going door to door to help people get assistance to move forward to a better day. The city delivers grants to nonprofits and groups on the ground, folks we are already doing work with and who need additional capacity. We are very strategic in our allocation so that we are delivering to the people who are making a difference in the communities. These are just a few of the initiatives at City Hall here in Annapolis. But with so many issues, we can't all work on our own or work in silos. Before COVID, we took up so much of our energy was taken up for testing, contact tracing, and later for vaccinations. We knew the foundational elements to a grander solution on gun violence would grow out of conversations with our partners in public health. The city strongly supports the strategies and approach of the gun violence intervention team and its partners. The mayor's office partners with Annapolis Police, Fire, Office of Emergency Management departments as a team. They are part of the wider community conversation in Annapolis. The Housing Authority is also, because its individuals in public housing are disproportionately impacted by gun violence. I've always believed that in order for Annapolis to be a great city, the great city has the potential to be, it has to be inclusive, as inclusive as possible. That is what makes a true community, one where people look out for one another. We have to continue to do community outreach and to invest in communities that are most vulnerable. We have to encourage and lift up people who are already working at the grassroots level and bring them into partnerships to fund and support and lift up their work. We have to continue having these conversations to find a balance between the rights of individuals and the freedom of our residents to live in communities not plagued by gun violence. These aren't easy conversations, but they are crucial to moving our communities forward. Thank you for letting me be here today. I truly appreciate the work of every single person on this panel. Thank you.
Thank you. Thank you so much to the health officer, to County Executive Pittman, and to Mayor Buckley for those opening remarks, and for making this, the safety and the well-being of our county residents, a priority. I'd like to share more about our gun violence intervention team, which came about in direct response to this county-wide commitment to addressing gun violence that we just heard about. And so the Gun Violence Intervention Team is an interagency coalition of over 24 government and organizational leaders who are coming together and collaborating in order to, firstly, investigate what gun violence looks like in Anne Arundel County so we can better understand the issue and develop solutions. And then secondly, to implement actionable strategies to both prevent and reduce gun violence in Anne Arundel County. And so, as the health officer emphasized, we are using a public health approach to this work. We're using data-driven information, and we're engaged with the community in order to do this work. So through our three-pronged approach, we're looking to move towards a vision of an Anne Arundel County where all residents are safe from gun violence. And as the health officer noted, we have 3 work groups within the Gun Violence Intervention Team who are doing this work. And each of them are looking to focus on making change at three critical levels: at a system level, through data, at a policy level, and at an environment level. And each of these work groups are focusing on a strategic priority of the vast number of strategies and activities that the groups are exploring. We have 3 strategic priorities that each of the work groups are focusing on currently right now. And so I'd like to share a little bit more about the data groups, whose goal is to create and publish a data report. But we also have the policy group, who's working to implement a public awareness campaign about gun violence and making sure we develop materials and target them to the populations who would most benefit. And then our environment group, who's focusing on the response side of things, understanding that gun violence ripples through communities. And so making sure we have a process and we provide services and support for these communities to help them heal from these incidents. But to share a little bit more about what the GVIT has been working on, and especially the data group, we've been able to compile police report incident data in order to have a more up-to-date understanding of what gun violence looks like in Anne Arundel County, and more specifically tracking the injuries and the deaths. And so from the work of the data group, we've been able to pull together a month-to-month snapshot of our injuries and deaths. And so we can see here so far we have data from January through April. And in that 4-month period from the police reports, we have reports of 10 suicides, 5 homicides, and 55 injuries due to firearms that have occurred throughout the county. And you can see that in the graph below. The blue line indicates the suicides month to month, and the red line indicates homicides. And so we're able to use this data to stay on track and to know what's happening and to track trends and developments as they're happening. We can also use this data to compare where we're at now with where we were in previous years. And so we can see here, this is showing those 4 months broken up by suicide and homicide. And you can see, starting with the top graph, we have the number of firearm suicides by month, and the blue line indicates 2021. So if we're looking at these trends, you can see that we started off the year a little bit lower than previous years, but we're starting to level out in terms of rates of firearm suicides per month. And then the second graph, we can see the number of firearm homicides by month, and we can see again that trend of starting lower than previous years. But we can see, especially in March, we're starting to see record numbers of firearm homicides across the county. And so in this way, we can track these trends and respond to them in real time and make sure our interventions are targeting these needs. Additionally, we've been able to pull police report incident data to start understanding where gun violence happens and being able to target our interventions in the communities most affected, making sure our strategies line up with what's needed. And so you can see on the left-hand side, we have the firearm homicide rate by zip code. And so you can see that there's concentrated areas, rates in eastern Anne Arundel County, specifically around the city of Annapolis, but also regions of North and West County. And then for suicides, we see different trends. And so we can see that suicide rates affect the county at a much wider scale. But we can also see, by comparing it at a rate per 100,000 residents, we start to see these areas pop up in South County that are disproportionately impacted by suicide. So in these ways, we can start to understand where gun violence happens, and that our interventions, we need to have unique interventions for communities in Annapolis as opposed to communities in South County. And so the data group has started to piece together this picture of gun violence in Anne Arundel County, and we'll continue to use this to inform our decisions and to inform our activities moving forward.